Welcome back, everybody. Today we're going to be taking a deep dive into lung surgery.
Lung surgery.
Yeah, specifically a procedure called VATS lobectomy.
Okay.
It's a minimally invasive approach to removing a lobe of the lung.
Yeah.
So we're going to explore why this is a game changer compared to the traditional open surgery.
Mm-hmm.
We'll learn about when this procedure is actually necessary,
Right.
how doctors even figure out if someone's a good candidate.
Mm-hmm.
And of course, we'll be diving into lung cancer and the complexities of its treatment.
Yeah.
One thing that I found pretty incredible while researching for this deep dive is that there was a study that showed VATS patients experience significantly less pain,
Oh, wow.
and they can return to work a full 2 weeks earlier than those who had open surgery.
That's huge. Yeah.
That's incredible to me.
It's a testament to the power of minimally invasive techniques. Those
Yeah.
smaller incisions really do translate into a faster recovery with fewer complications. Reduced pain, faster healing time,
Yeah.
shorter hospital stays.
That's going to make a huge impact.
Absolutely. Makes a
Wow.
world of difference for the patient's overall well-being.
Yeah, so let's back up a little bit. Okay.
Sure.
What does a VATS lobectomy actually entail?
Well, instead of a large incision like you'd see in traditional open surgery,
Right.
surgeons use a thoracoscope.
Okay.
It's basically a tiny camera
Okay.
along with special instruments.
Mm-hmm.
And these are all inserted through just a few small incisions.
Wow.
So they can see inside the chest cavity
Yeah,
and very carefully separate the lobe of the lung that needs to be removed.
that sounds incredibly precise.
It's a very delicate procedure.
So under what circumstances would a lobectomy be performed?
Well, the most common reason is lung cancer,
Okay.
but it can also be used to treat other conditions,
Mm-hmm.
like aspergilloma.
Okay.
That's a fungal growth in the lungs,
Ah.
also tuberculosis and lung abscesses.
Now, when it comes to lung cancer,
Right.
it's obviously a very serious diagnosis.
Absolutely.
How do doctors even begin to investigate a suspected case of lung cancer?
Well, it starts with a very thorough history and physical exam,
Okay.
and then a standard chest x-ray.
Okay.
If lung cancer is suspected, they'll order additional tests,
Mm-hmm.
like a CT scan of the chest, abdomen, and pelvis.
So that CT scan's really helping them see the extent of the cancer.
Exactly. It helps determine the stage of the cancer, which means how far it is spread.
Okay. Then what?
Then, to confirm the diagnosis, they need to get a tissue sample.
Okay.
They can do this through a bronchoscopy,
Mm-hmm.
which allows them to visualize the airways and take a biopsy.
Okay.
Sometimes they might use EBUS, which is endobronchial ultrasound,
Mm-hmm.
or even a CT-guided biopsy
Okay.
to get a more definitive sample.
And let's say after all that surgery is recommended,
Right.
how do they make sure the patient is ready for a procedure like this?
That's where the pre-surgical evaluation comes in.
Okay.
They'll do another thorough history and physical exam,
Mm-hmm.
but the really crucial part is the lung function testing.
Right.
They need to make sure the lungs are working well enough to handle the surgery.
Why are these lung function tests so important?
Well, they can reveal a lot about the patient's respiratory health.
Mm-hmm.
One of the key tests is called FEV1.
FE1.
It stands for forced expiratory volume in 1 second.
Okay.
It measures how much air you can forcefully exhale in 1 second.
Okay.
This gives doctors a clear picture of your lung capacity.
Mm-hmm.
If you can't exhale enough air, it could indicate that your lungs might not be strong enough
Right.
to recover properly after surgery.
That makes sense. Are there any other tests?
Yeah, they also use something called cardiopulmonary exercise testing,
Okay.
or CPITR.
Mm-hmm.
This assesses your overall fitness and how well your heart and lungs work together during exercise.
I was reading that there are specific thresholds for FEV1
Yes.
and VO2 max that doctors use to assess surgical risk.
That's right.
Can you break that down for us?
Sure, so for a lobectomy,
Okay.
the patient ideally has an FEV1 of at least 1.5 liters. If they're considering a pneumonectomy,
Okay.
which involves removing the entire lung,
Wow.
then an FEV1 of at least 2 liters is desirable.
They really want to make sure your lungs are up for the challenge.
Absolutely. Lung function is a critical factor in determining the patient's suitability for surgery.
Okay, so let's shift gears a little bit and talk about the different types of lung cancer.
Okay.
Lung cancer is broadly divided into two main types.
Right.
Small cell lung cancer
Mm-hmm.
and non-small cell lung cancer,
Correct.
or NSCLC.
Yeah.
Small cell lung cancer accounts for about 20% of cases,
Mm-hmm.
and it's known for being very aggressive.
Yes, very aggressive.
Unfortunately, it's usually treated with chemotherapy and radiation.
Right.
because surgery is rarely an option.
Yeah, that's right.
And what about NSCLC?
NSCLC is more common,
Okay.
and there are several subtypes,
Right.
but the two most common are adenocarcinoma
Okay.
and squamous cell carcinoma.
So what are the differences between those two?
Well, adenocarcinoma is often found in the outer parts of the lungs,
Okay.
and it's more common in people who have never smoked
Mm-hmm.
or were light smokers.
Okay.
Squamous cell carcinoma, on the other hand,
Mm-hmm.
is usually linked to a history of heavy smoking,
Right.
and it tends to develop in the central part of the lungs.
It seems like there's a lot to consider
There is.
when it comes to lung cancer.
Yeah, it's a complex disease.
Does the treatment approach vary depending on the type of lung cancer?
Absolutely. The treatment is highly individualized
Yeah.
and depends on both the type and stage of lung cancer.
Mm-hmm.
For early stage NSCLC,
Yeah.
surgery or radiation therapy may offer a cure.
Okay.
However, advanced NSCLC often requires a combination of treatments,
Okay.
like chemotherapy-targeted therapy and immunotherapy.
This is all so fascinating, but it is a lot to take in.
It is.
Should we maybe take a pause here
Yeah, let's take a break.
and pick up the conversation in part 2 of this deep dive?
Sounds good.
Okay, so we're back. And one thing that I found pretty interesting is that even years after a VATS lobectomy, a doctor could probably tell
Oh, yeah.
that's the procedure you had just by looking at the scars on your chest.
That's true. Those scars can tell a story even as they fade.
Yeah.
A trained eye can often spot the telltale signs of past surgeries.
What exactly would they be looking for?
Well, with a VATS procedure, you'd typically see 3 scars forming a sort of triangle pattern.
Mm-hmm.
The largest one is called the utility incision.
Okay.
It's about 3 to 6 centimeters long and located on the side of the chest.
Okay.
And then the 2 smaller scars are for the surgical instruments and the thoracoscope.
Right.
And those are usually positioned above and below the utility incision.
So it's like a little roadmap of the surgery.
Exactly. And if you contrast that with a scar from an open thoracotomy,
Yeah.
the difference is pretty striking.
Mm-hmm.
That incision can be 15 to 20 centimeters long, running along the side of the chest.
Wow. So let's talk about the actual steps involved in a VATS lobectomy.
Sure, the first step is general anesthesia,
Right.
which ensures that the patient is completely asleep and doesn't feel any pain.
Mm-hmm.
Once the anesthesia takes effect,
Yeah.
the surgeon makes the 3 small incisions that we discussed.
Mm-hmm.
One for the thoracoscope,
The tiny camera.
right, the tiny camera
Hmm.
that allows the surgeon to see inside the chest cavity.
Yeah.
It transmits images to a monitor,
Okay.
giving them a real-time view.
Uh-huh.
Then through the other incisions,
Yeah.
specialized instruments are inserted to carefully separate the lobe of the lung
Okay.
that needs to be removed.
What happens once the lobe is free?
Once the lobe is free,
Yeah.
it's removed through one of the incisions.
Okay.
Then the incisions are closed
Mm-hmm.
with sutures or staples.
Okay.
And a chest tube is usually inserted
Okay.
to drain any excess fluid or air that might accumulate after the surgery.
And what about recovery?
Recovery from a VATS lobectomy is generally much smoother and faster
Then
than open surgery. Most patients stay in the hospital for a few days while the chest tube is in place.
Mm-hmm.
Pain management is a priority to keep the patient comfortable.
Okay. And once the chest tube is removed, they go home.
Exactly. Once the chest tube's out, patients can usually go home and start gradually returning to their normal activities.
Are there any restrictions?
There are some restrictions in those initial weeks.
Mm-hmm.
Strenuous activities and heavy lifting are off limits
Makes sense.
while the body heals.
Yeah.
Patients are also encouraged to do breathing exercises,
Okay.
which help expand their lungs and prevent complications.
Right, like pneumonia.
Exactly.
It's pretty incredible how far these surgical techniques have come.
It really is.
This conversation's got me thinking about just lung health in general.
Yeah.
What can people do
Mm-hmm.
to protect their lungs and maybe even prevent,
Right.
developing lung problems down the road?
That's a great question. And it's never too early to start thinking about lung health.
Mm-hmm.
The most important thing by far is to avoid smoking. Smoking is the leading cause of lung cancer
Right.
and a major contributor to other lung diseases like COPD.
It seems obvious.
It does. But it's worth emphasizing over and over again.
Right.
If you do smoke, quitting is the single best thing you can do for your health,
Yeah,
no matter how long you've been smoking.
really.
It's never too late
That's great to know.
to quit and reap the benefits.
What about people who don't smoke but are exposed to secondhand smoke?
Avoiding secondhand smoke is just as important.
Okay.
And your environment plays a big role, too.
Mm-hmm.
If you work in an industry where you're exposed to dust fumes or other irritants,
Yeah.
make sure to wear protective gear.
Right.
like masks or respirators.
Safety first.
Absolutely.
What about everyday things? Are there other things people can do?
Yeah. Regular exercise is another powerful tool.
Mm.
It strengthens your lungs
Okay.
and improves your overall cardiovascular health.
Which is good for the whole body.
Exactly, including your lungs.
So a holistic approach is key here.
Absolutely. And don't forget the importance of regular checkups
Okay.
with your doctor.
Mm-hmm.
They can help identify any potential problems early on
Right.
when they're often easier to treat.
Early detection is so important.
It really is a crucial aspect of maintaining good health.
And vaccinations play a role too, right?
Absolutely. Getting your flu shot every year
Yeah.
is so important.
Yeah.
The flu can be really harsh on the lungs, especially for people who are already at risk.
Right. It's easy to forget about those routine vaccinations.
Yeah, they're easy to overlook,
They're so important.
but they really do make a difference.
So it sounds like it's really a combination of smart choices
Mm-hmm.
and proactive health care.
Exactly.
That can really go a long way
It really can.
in protecting our lungs.
Mm-hmm.
Before we wrap up, I want to touch on something that I found really interesting.
Sure.
So you mentioned how those smaller incisions from VATS lobectomy really lead to a faster recovery. But how much faster are we talking?
Well, studies have shown that VATS lobectomy patients can usually return to work
Okay.
in about 4 to 6 weeks, compared to those who have open surgery, who often need 8 to 12 weeks.
That's a big difference.
It is a significant difference.
Yeah, especially considering the financial and emotional burden
Right?
of, being out of work for that long.
Exactly.
Yeah.
It can really impact a patient's quality of life.
This deep dive has really opened my eyes to the complexities
Yeah.
of lung surgery.
It's a fascinating area of medicine.
It is. We've learned about the advantages of VATS lobectomy,
Mhm.
explored that whole rigorous diagnostic process,
Right.
and really highlighted how important a thorough pre-surgical evaluation is.
It all plays a crucial role.
And of course, we talked about the different types of lung cancer,
Mm-hmm.
the treatment options,
Yeah.
and how research is constantly evolving to improve outcomes for patients.
It's an exciting time for advancements in lung cancer treatment.
One thing that's really stood out to me throughout this whole conversation
Yeah.
is the teamwork involved
Oh, absolutely.
in this process.
It's not just about the surgeon.
Right.
It takes a whole team
Yeah.
to guide a patient through this experience.
Yeah. From the diagnosis to the surgery, the recovery, it's a collaboration between the patient,
Right.
the surgeon, anesthesiologist, nurses, respiratory therapists.
And the radiologist.
Oh, yeah. And the radiologist.
Interpreting those scans.
Yeah.
And helping guide the treatment plan.
Right. And even the pathologists.
Yes.
Who analyze the tissue samples
Exactly.
to determine,
the type and stage of the cancer.
Yeah, the specifics of the cancer.
It's a true team effort.
It really is. It's like this amazing symphony of medical expertise coming together.
It's quite remarkable.
So as we wrap up,
Yeah.
I want to leave our listeners with
Okay.
something to think about.
Sure.
If you were designing the ideal lung cancer treatment, what would that look like?
That's a great question.
Yeah.
Ideally, it would be a treatment that's highly effective, minimally invasive,
Okay.
and has minimal side effects.
Right. And of course, a rapid recovery time.
Absolutely. A quick return to normal life is
Right.
essential.
Yeah.
It would also be personalized to the individual patient,
Okay.
targeting the specific characteristics of their tumor.
And accessible to everyone.
Yes, exactly, regardless of location or financial situation.
It sounds like the ultimate goal is to make lung cancer treatment
Mhm.
as effective and as seamless as possible.
That's the dream.
We're not quite there yet.
Not yet.
But the progress we've made in
Mhm.
recent years is definitely encouraging.
It is. We're making strides every day.
Well, it's been a pleasure exploring this topic with you all.
Likewise, it's been a great discussion.
We hope you've learned something new, and maybe we've sparked your curiosity
Yeah,
to learn even more about lung health.
absolutely. Knowledge is power.
Yeah, and the more we understand
Right.
about our bodies and these medical advancements, the better equipped we are to advocate for our health.
Couldn't agree more.
So keep learning,
Yeah.
keep asking questions,
Keep those questions coming.
and as always,
Mm-hmm.
keep breathing easy.
Until next time.